All right, so we're still in the gram-positives, but these are non-spore-forming gram-positive rods. So we just have two, Corynebacterium diphtheriae and Listeria monocytogenes, which we already talked about once before, but never hurts to review it again. So that's for you, and that's where it's located in your textbook. So we talked about diphtheria as a disease when we talked about vaccines. And so we're very grateful that we have a vaccine for it, but prior to that, it was treated with antitoxin, because the bacterium Corynebacterium diphtheriae makes this deadly cytotoxin, and it causes pseudomembranous pharyngitis. The thing is, the toxin then disseminates, it spreads, it can go to the rest of the body, causes paralysis, and can affect the heart and the kidneys, and was fatal. So that's the whole Balto. If you've ever watched Balto, yeah, it was bringing the antitoxin to Nome, Alaska. It is contracted, so through respiratory droplets, but you can kind of see we don't have a lot of diphtheria, thankfully, because we immunize against it, and people are just sending to get on people to get their booster shot as well. So you'll see that we started using the vaccine in the 1940s, but you'll see outbreaks in the unimmunized, so it hasn't gone away. And this was a slide we looked at before. We talked about the Christmas miracle, so that first antitoxin or antibody treatment. And like I said, the reason we have a vaccine is because even with treatment, it is fatal. So even if someone's in a hospital, that toxin is very powerful, and once it's disseminated, it's very difficult, particularly if the patient is under the age of 5. It is an AB toxin, so it has the binding portion, and then it has the active portion, and this cytotoxin, it shuts down protein synthesis. So it just causes cell death, because a cell cannot live if it can't make proteins. And so it comes in through respiratory droplets, binds to respiratory epithelium, pseudomembranous pharyngitis, and then that pseudomembrane can actually come dislodged and block the respiratory system. And just neutralizing antibodies would be a treatment, but now we have the DTaP vaccine, so the tetanus toxoid. So the toxoid is the non-harmful part, so our immune system has immunity to the toxin, not to the bacteria, and the diphtheria toxoid as well, so immunity to the toxin. Like I said, the problem with these, when it's a toxin, the toxin acts faster than your immune system can respond. So it's not really, it's all about the toxin. So prevention through vaccination. Like I said, if someone does get the disease, it's antitoxins and antibiotics and supportive care. Listeria monocytogenes, we saw this before, so we're not going to watch them again. So this bacterium is facultative, so it's flexible, but it can live inside our cells, and so that's how it can move around. It targets macrophages and epithelial cells, and when it's inside a cell, it can't be phagocytized. So it causes meningitis, and you're going to be worried about the immunocompromised. So the elderly, the very young, and then pregnant women, there's an extra concern. Most people, if they're healthy, it's going to be asymptomatic or just really mild gastrointestinal, like, oh, I don't, little nausea, things like that. The problem is it can spread from the gastrointestinal tract and go to the meninges, so the central nervous system, and cause meningitis. So it is the only foodborne meningitis that we're talking about. In the pregnant woman, if she gets infected with listeria, she may have no symptoms at all, or she may have like flu-like symptoms and little upset stomach. I'm not saying you don't care about mom, but the problem is it can cause miscarriage, it crosses the placenta, and can cause neonatal meningitis. And so neonatal, within 1 to 4 weeks, the infant gets meningitis, and it's 33% fatal. Alex, I don't know if you guys remember Chapter 9, our clinical focus with Jenny. I think Jenny ate some unpasteurized cheese or raw cheese. Listeria was also the cause of the 2015 bluebell outbreak. It was all gone. It's very sad. Love my ice cream. It was sad. I love my ice cream. But have you ever heard that pregnant women shouldn't eat unpasteurized or soft cheeses? That's one of the reasons, because, like I said, it's vertically transmitted to the fetus. I said, not saying we don't care about mom. We do. It's all about the baby. But just virulence factors, and like we talked about, so intracellular growth, macrophages, epithelial cells. So this gives it that protection. It can escape from the phagosome. So when it's brought in by a phagocytic cell, it makes Listeria lysins that allows it to escape, and then it has those actin tails, so it can just kind of go anywhere from there. And so it's invasive in some people, and so you get bacteremia, and then it goes to the central nervous system. That's for you. All right, so we've talked a lot about meningitis, and like I said, I'll just keep circling back around. So we've already talked about Streptococcus pneumoniae, which is the #1 cause of bacterial meningitis. Well, we're going to add another bacterial meningitis, so I have this no rash, and we have a vaccine for that one. Streptococcus agalactiae, we talked about that as a resident bacteria in the microbiota of some women, and so they're supposed to test the moms, but if they're not tested and no antibiotics are given, it's the #1 cause of neonatal meningitis. And then we just mentioned Listeria monocytogenes, which were also vertically transmission. It is the only one that's foodborne, so watch out for soft cheeses, but it can be through other foods as well. I'm not saying that's the only food, but if you've heard about pregnant women aren't supposed to eat soft cheeses, it's one of the reasons why. So you're worried about pregnant women, your neonates, so newborns, elderly, and immunocompromised. Those are the people that are going to get meningitis from that. So most meningitis are viral. Let's do acid fast. We can do it. So Mycobacterium tuberculosis and Mycobacterium leprae are our two species that are the acid fast that we're talking about. Remember, they're the ones that have a unique waxy mycolic acid wall outside of their peptidoglycan, which makes them very resistant to drying, makes them resistant to disinfectants. They can also survive within macrophages as well, and they elicit a very strong cell-mediated immune response that sort of is going to enhance the disease pathology. Later, I think at the end of this unit, we're going to do an acid-fast stain. That is a selective or differential stain for the bacteria that might have that mycolic acid wall. So we can tell, and so this is an example of a sputum stain looking for Mycobacterium tuberculosis. There's also selective media as well for Mycobacterium. They are aerobic. They are pleomorphic, meaning they don't always have the same shape. They are technically gram-positives. Like I said, they can live within our cells, but they don't have to. They are really slow growing. Like, we are working on the ones we're growing. We'll see if we have enough for everyone to do an acid-fast stain. So yeah, for Mycobacterium leprae, the incubation period is years. Like, slow. They're slow growing. The two diseases, they cause tuberculosis. Leprosy, that's not a very nice name. It has a stigma attached to it. The more politically correct name is Hansen's disease, but if I said Hansen's disease to you, yeah, might not know that. Humans are the only reservoir for Mycobacterium tuberculosis. Armadillos, our state animal, is the reservoir for leprosy. Yeah, so for Mycobacterium leprae, that's why you should not touch dead armadillos. These diseases, both of them, they are communicable, so you do get them from other people, but they're not highly contagious. Okay, like, so yes, it is person-to-person transmission, but not highly contagious. You're going to see it in populations at risk, so immunocompromised, elderly, children. The big thing globally, these are infections of poverty. So when people are poorly nourished, poor sanitation, crowded areas, that's where you're going to see more tuberculosis and more leprosy. That's for you. So TB is interesting. It is on the rise and drug resistant.
In 2008, archaeologists uncovered two 9,000-year-old skeletons. There's no definitive way of knowing what killed these ancient people, but we do know their bones were infected by an all-too-familiar bacterium. The ancient Greeks knew its consumptive effects as phthisis. The Incans called it chakionke, and the English called it tuberculosis. Today, tuberculosis, or TB, is still one of the world's biggest infectious killers, causing more deaths than malaria or even HIV and AIDS. But what exactly is this disease, and how has this pathogen persisted for so long? Typically, TB bacteria, called Mycobacterium tuberculosis, are airborne. They travel into our airways and infect our lungs. Here, immune cells called macrophages rush to the infection site, attempting to absorb and break down the bacterial invaders. In many cases, this response is enough to remove the bacteria, but in individuals with other medical conditions, ranging from malnutrition and HIV to diabetes and pregnancy, the immune response may not be strong enough to destroy the intruder. If so, Mycobacterium tuberculosis will reproduce inside those macrophages and form colonies in the surrounding lung tissue. As they infect more cells, the bacteria employ cell-degrading enzymes that destroy the infected tissue, triggering chest pain and causing patients to cough up blood. The damage to the lungs leads to oxygen deprivation. This begins a flood of hormonal changes, including a decrease in appetite and iron production. From here, microbes can spread to the skeletal system, causing back pain and difficulty moving, to the kidneys and intestines causing abdominal pain, and to the brain, causing headaches and even impaired consciousness. These symptoms produce the classic image of TB: weight loss, a hacking bloody cough, and ashen skin. This ghostly appearance earned TB the title of the White Plague in Victorian-era England. During this period, tuberculosis was considered a romantic disease because it tended to affect poverty-stricken artists and poets, those with weaker immune systems. TB's outward symptoms even helped fuel the popular myth of vampirism. In spite of, or perhaps because of, these less than scientific concerns, this period also marked the first strides toward curing TB. In 1882, the German physician Robert Koch identified the disease's bacterial origins. 13 years later, physicist Wilhelm Röntgen discovered the X-ray, enabling physicians to diagnose and track its progression through the body. These techniques allowed researchers to develop reliable and effective vaccines, first for smallpox and again in 1921, when scientists developed the BCG vaccine to battle TB. These developments laid the groundwork for the modern field of antibiotics, currently home to our most effective TB treatments. But antibiotics fail to address a major diagnostic complication. About 90% of people infected with TB don't show any symptoms. In these latent infections, the TB bacterium may be dormant, only activating when someone's immune system is too weak to mount a defense. This makes TB much harder to diagnose, and even when properly identified, traditional treatments can take up to 9 months, requiring multiple drugs and a high potential for side effects. This discourages people from finishing the full course, and partial treatment enables bacteria to develop resistance to these drugs. Today, the disease is still prevalent in 30 countries, most of which face other health crises that exacerbate TB and trigger latent cases. Worse still, accessing treatment can be difficult in many of these countries, and the stigma towards TB can discourage people from getting the help they need. Health experts agree we need to develop better diagnostics, faster-acting antibiotics, and more effective vaccines. Researchers have already developed a urine test that yields results in 12 hours, as well as a new oral treatment that could cut treatment time by 75%. Hopefully, with advancements like these, we'll finally be able to make TB exclusively a thing of the past. How do vaccines work, and how do they help eradicate diseases? Check out this lesson to learn about the science behind.
Okay, so there are multi-drug resistant strains. That is a concerning threat of the CDC. So 500,000 new cases of multi-drug resistant. So that means you have to use a combination therapy, and you can see that, like I said, we can't get people to take antibiotics for 10 days, let alone months, and that's why this has occurred. And then there are now strains that are extra drug resistant tuberculosis, meaning we don't have anything to treat those really, or not effectively, and so there's 70% mortality within months of diagnosis for those. So the weird thing about,
I'm vaccinated.
sorry, and that was just sort of some historical things. So there's primary infection, and then there's the disease itself. So we'll look at it in a moment. And usually it just affects the respiratory system, but it can disseminate and go outside of the lungs. So the spine, it can go to the kidneys, and can also go to lymph nodes and cause swelling in the neck. So this is a sanatorium. And actually, my grandfather and my aunt died of tuberculosis. My mom's from Austria, so World War II, not a lot of food. They lived in the city, so bad conditions. They probably smoked, and so they had TB. So my mom grew up with 2 people that died of TB, and she never tested positive. So that's what is meant by, it is communicable, but it's not highly contagious. Okay, it's only, you can live with someone with TB, and about 30% of the time will someone catch it. So how when you go into healthcare, you have to get your TB tests, right? So you've probably already had it. If not, you're going to have it. So how that works is you're exposed to it. Like I said, most people, immune system takes care of it, nothing. Like you would test negative at that point. Other people with risk factors, okay, then they get an infection, and maybe they're going to be asymptomatic. They might have a just mild, just respiratory kind of thing. They're not infectious at this point, but now their immune system has seen it, so they would test positive on a TB test. So they're infected, but they don't have TB. So TB is a latent, the disease is latent, so it waits, okay, till someone's immune system is weakened, and we'll look at the progress of that. And then, like I said, it may never reactivate. So risk factors, only about 5 to 10% of people that have been infected actually ever go to the disease itself. Now, if they have the disease, then it's highly transmissible, like in the fact that it only takes 10, but most people can, like I said, aren't going to get it. Only about 30% will, if, like I said, it's the crowded, it's poverty-stricken type of disease. So what's happening in the lungs is the formation of tubercles, which is how it got its name, so tuberculosis. These cells, in some people, they can live inside the macrophages, so the macrophages can't take care of them. And yeah, so they multiply inside them, and so you get infected macrophages, and the other macrophages come around, and lymphocytes come around, and then they try to wall it off to contain it. And so that is a tubercle, and you can see that histologically in a lung. The bacteria inside that tubercle, they're not dead, they're still there, there's fewer numbers, and that may be the end of it, but what can happen is then they will start releasing chemicals, and they basically are killing the tissue inside of that tubercle, and it looks like cheese, so caseous necrosis, caseous means cheese, and so someone might have these little tiny things inside their lungs, and it may just stay like that. Never know, just they're infected, they don't have it yet. Then later what happens is the bacteria, because the immune system is failing or weakened, then they start to divide, and then the tubercle ruptures and goes throughout the lung and then destroys the lung, and then that's when someone is coughing up blood. And so that's when they have the disease. And so that wasting, fevers, pallor, and that is, they believe that is when they wrote the story of vampires and all of the thing about all the vampires being from Eastern Europe. There's a lot of people with TB. That's what it was. Gaunt, pale people with blood coming out of their mouth. So that test, Mantoux test, or the PPD test, where they just take some of that purified tuberculin, they inject it underneath the skin, and then they wait. You have to come back 48 to 72 hours later to see if you've been exposed, because it's going to be that cell-mediated response, so it's like that delayed hypersensitivity, and they're going to measure it for size. Other things in the field, because that takes time, is they can do a acid-fast stain on sputum, and if they see acid-fast bacillus, then that person has tuberculosis. And treatment, multiple drugs for months, and like I said, low patient compliance, poor access to medications. And so billions of people. Yeah?
My parents, they get the TB test, but for my mom, it always bumps up, but she doesn't have it.
Right.
When does it come?
She's been exposed, so she has,
exposed to it?
yep. So she's here, so non-infectious. And like I said, majority of people, nothing happens.
Gotcha.
But
the Navy made my brother-in-law, he had to take medicine for like 9 months.
Yeah.
He was going on a submarine and, they tested him for
Just positive.
Yep, and he was only 18 years old.
yes, and those of you going into healthcare, if you test positive, yeah.
This was like in 99 or whatever, so within the last 18 years of his life, I guess he has been exposed to TB, which was crazy.
Yeah.
Yeah.
And like I said, it is out there. Like I said, it is transmissible. It's just not highly contagious. Like I said, my mom never tested positive, ever. You have to fill out the history forms, and even when she was coughing up blood, she died of lung cancer. They quarantined her then and got all that attention then. But yeah, so that's what I mean by it's transmissible. It's just not highly contagious, unless the crowded, poor, poverty-stricken, immunocompromised.
After they take the antibiotics, do they continue to test positive? Like if you take the antibiotics forever and ever, I mean, like
You will still.
You're going to be. Is it considered a carrier of it?
You would not. It would not go to disease if you've been treated with antibiotics.
Okay.
But this is, remember, it's an immune test, so you still have memory cells, so you will still test positive.
So that it's not 100% guarantee that you won't actually get it.
The antibiotics should have.
Done its job. I mean, okay.
That's all you can do.
Yeah.
But once your immune system has seen it, then you're going to test positive. So that just shows exposure. There's somewhere and then too, there are some countries that vaccinate for TB, so if someone's been vaccinated, they will test positive. So
They have, my family, they have like this little bump thing that's like indent, and they're like, were you vaccinated? And they're like, yeah. And then they have to look at it, and they're like, oh, you're fine.
yeah. Oh, okay. Well, yeah. So they were vaccinated. They're going to test positive always.
So why didn't we just start from there? And they're like, it doesn't. We still have to do it. Okay.
Yeah, you're
My
right.
mom hates the little bump thing.
Yeah.
She's like,
Well, they're not fun. That's.
She's like, this is so much, so lame. It's such a waste. And my sister has to do it too every year.
Oh. Okay. So they were all vaccinated. Well, yeah, they're going to test positive.
They're from Colombia.
Oh, yeah. Okay. And so they vaccinate there.
Anywhere.
Great. Yeah.
I'm the safe one.
You're the one that doesn't have to get tested all the time. All right, so just our last one, and then I'll let you guys go. So Mycobacterium leprae. This is, once again, now you're not going to see a lot of it in the United States. These are the countries that it is very high in some countries. This is the only pathogen that affects peripheral nerves, so it's going to affect sensation. It's going to also cause some muscle weakness. Transmission is through human-to-human contact, mainly by nasal secretions or from a lepromatous. That's so difficult for me to say. Lepromatous, if they have leprosy sores from there. So tiny minority of people that, same thing as tuberculosis, that are exposed actually get the disease. It's high in India, Brazil, and Indonesia. It is endemic to armadillos. And so CDC is telling everyone stop touching dead and playing with dead armadillos in Texas or any other state. But we have a lot of them. There's one I swear there's a dead one on my street every other week.
On that podcast I listened to, I just heard it yesterday. There was in the United States, kids were playing with armadillo like soccer ball, and they got it.
Yes.
It's not funny, but like they were playing.
It's not funny, but we're all laughing. It's microbiology class.
What do you do? Like, what are y'all playing with an armadillo? Oh, okay.
Well, no one thinks of leprosy, though, right?
I don't know.
Yeah. Anyway, so long incubation period, so period about 3 years, but it could be as long as 20 years. So these are very slow-growing microorganisms. Yeah, I'll stop it here. I didn't say that. There's more for my videos. That's well. It's a nice line. It's a nice line. Okay, so we're going to start off with lab. So please come on time on Wednesday.